how long does it take for Thymosin Alpha 1 to work? In this video, we'll deconstruct what Thymosin Alpha 1 is, how quickly it can act on the body, how soon your body metabolizes it. And think of this not like an espresso shot. It's not like an immune booster. It's a complete immune remodulator. So it creates an intelligence in your immune system that exists when we're younger, and it starts to expire as we age. So by the end of this video, you'll understand exactly what shapes the results from an immune perspective and what the realistic outlook is as far as timing to see results. So I'm Regan Archibald, founder of Ageless Future. We've got a phenomenal medical team that runs the right labs to find out where your immune system or your metabolic system or your detoxification or hormones are compromised. We run over 100 markers in our blood labs, and it can help you understand where your interferences are. And then my team can help you get the energy so you can perform your best, you can look your best, and feel your best. No matter what age you are, just go to agelessfuture.com. So this is not medical advice. Thymosin Alpha 1, just for the record, it did have orphan drug status where it was used for many conditions in the United States under the drug name Zidazine. I apologize if the pronunciation of Zidazine is not correct, but right now it is approved in 35 to 37 countries, mostly in Eastern Europe, not in Japan or most of Western Europe. Italy is a place where it is utilized. But I think of this as just a gold mine when it comes to immune intelligence, because one of the risks that we all have as we age, and you've seen it, our immune systems lose intelligence. This is why the elderly people are at the greatest risk when we have different bugs going around, whether it's influenza, COVID, doesn't matter. That's where our bodies have this weakening. And so if we can increase the intelligence of your immune system and prevent this thing called immunosenescence, and immunosenescence is when your immune cells become zombified, and so they don't understand what's a threat and what's not. This is, you go back to this innate and adaptive immune response. Thymosin Alpha 1 can help stabilize it and set the record straight so that your immune system knows what to go after. So how long does it take? Well, some people, it's a fast signal. You'll notice it right away. Others, it may be slower. I have a history of autoimmunity. Thymosin Alpha 1 is something I was able to use over 10 years ago. And I found that right out of the gates, within 2 days of using it, my energy increased by about 15 to 20%. My sleep improved. I felt less achy in my body. Actually, I also found that my blood labs, I've always had a higher levels of lymphocytes and my white blood cells have been low. But the periodic use of Thymosin Alpha 1, cycling it, and when we could get it from our compounding pharmacies, I had dramatic improvements in white blood cells. My lymphocytes stabilized, my neutrophils improved, so I had that 2-to-1 ratio. The results were really impressive. I travel a lot, don't get the same sickness, but other people, it may take longer. I haven't seen any studies that identified do women respond better than men. Generally speaking, because it's regulating this Th1, Th2, Th17, I do see this as being even more prime for females who are looking to optimize immune function. But once again, talk to your medical provider and make sure that Thymosin Alpha 1 or any peptide, you're not using it from a source that you're not sure that it has the 503A or 503B license compounding pharmacy, because that compounding nature of it, making sure you have a prescriptive based for Thymosin Alpha 1 can change everything. Otherwise, you may just be getting a fragment of this 28 amino acid profile. So Thymosin Alpha 1 is interesting. So here's a study I'll share with you. Now, this study was done, and what they were looking at is they wanted to find out how long does Thymosin Alpha 1 stay in the body. And what they found is the half-life is approximately 2 hours. And they found that even if you're using it multiple times throughout the day, and this is in many hospital cases where people come in and they are very critically ill, they could use it without this accumulation of toxicity. That's one of the benefits of many of these peptides, is the toxic burden is downregulated because these peptides are metabolized so quickly. Thymosin Alpha 1 is no different. So this study, what they did, they had 120 different participants in this study, and the patients, they were separated out into, this is a phase 3 translational study. They were separated into the control group and then the placebo group. And what they found is that the Thymosin Alpha 1, the study was titled Reset Alpha Study, a double-blind randomized multi-center phase 3 trial for efficacy and safety of Thymosin Alpha 1 in sepsis patients. Now, sepsis is when you've got bacterial invasion over your whole body, and a lot of people don't make it through that. But because they saw the benefits of Thymosin Alpha 1 and they had these patients with sepsis, they wanted to see, would Thymosin Alpha 1, when added to the protocol, would that help in the outcomes? And so once again, they were separated into two groups, Thymosin Alpha 1 injections versus the placebo group. And they were looked at over the course of 7 days while also receiving standard care. Now, this is pretty interesting because the first thing they found in the sequential organ failure assessment, because what sepsis can do is shut down all of the organs in the body, they found that number one, the scores of Thymosin Alpha 1 versus placebo, they had a better recovery. So that was one of the quantifiable data points. They had a shorter hospital course. Thymosin Alpha 1 patients left roughly 12 days on average, whereas the group that had the placebo was 14 days. And you may say, well, that's not dramatic, but it's almost leaving the hospital 25% sooner, whatever the math is, 20%. That's a big deal, and that's 2 days in the hospital. They also found that there was reduced ICU and ventilator time, so they were out of the intensive care unit in shorter periods of time. They found in less than 2 days versus the placebo group, which meant they had more aggressive interventions. They found that mortality trend, there were numerically fewer deaths with Thymosin Alpha 1 with sepsis versus the placebo group. And then the biometric support, they looked at the cytokines, they looked at the tumor necrosis factor alpha, they looked at C-reactive protein, the NLR pathways, and this all indicated that Thymosin Alpha 1 helped remodulate the immune system biologically for better clinical outcomes. The safety, Thymosin Alpha 1, I've seen many of these safety studies on Thymosin Alpha 1 where in some cases it outperformed placebo, like you could inject saline and have more side effects versus even Thymosin Alpha 1. That's what they found here. It was very acceptable with the standard care. There was no competing issues with it. And once again, these people are critically ill. If there's a cohort to study, this would be it. Why it's important is because Thymosin Alpha 1 or TA1, they're not looking at it to replace the standard of care. All they're looking at is how can we just change the signaling of the immune system? How can we get these patients to help have more intelligence, more resilience in their immune system? And this is just one of the many studies on this beautiful peptide that actually shows that Thymosin Alpha 1 may be very beneficial when it comes to long-term immune health. And Ageless Future, as the CEO of the company, I'm always looking at what are the leverage points that we can provide our clients so that they have the best possible outcome and the best possible chances of really making it to that next decade in greater health than they were this previous decade. And the signaling timing of the immune system is one of the most important pathways because the immune system is informed by your gut. So it does start with doing a stool analysis, looking at your blood labs. There's a test called Biome Burden from Cyrex that shows the intelligence of the immune response, the Treg cells, what your white blood cell count is, also shows your Th1, Th2, Th17, how all these are interacting. It's really important because Thymosin Alpha 1, once again, it's a software update. It completely regulates and improves all the signaling across these different contexts. So it helps with immune stress, it helps with aging immune patients, it's used in complex protocols, even as chemotherapy adjuncts, so patients undergoing cancer treatments. But it's like retraining a team where you get new adaptive systems, you have team members that are more creative, they make the right decisions, and I love that quote by Dr. Phil. He said, some decisions are the right decisions, others we make right. And Thymosin Alpha 1 seems to have the signaling capabilities in the stack to be an overall strategy for longevity, because it's like the conductor that arrives before the orchestra. And now the orchestra, it helps coordinate and eases the complexity in the body. So for those of you who are looking to go deeper in your health, and for those of you who really want to know how Thymosin Alpha 1 actually works, I'm going to provide a link to that video in the show notes, and I'll see you there.